I'm Bethany Files. I'm a practical nursing instructor at Meridian Community College. Today I will be talking about some of our personal care skills that we need to know as a nurse in order to take care of our client. So I'll be referring to your personal care skills practice sheet. And we're going to be looking at the skills that here are at the lower page where you did not have a video from the Taylor's DVDs to watch. So the first thing that I do want to draw your attention to is when you're looking at each skill, you will see page numbers listed beside each, and that will let you know where to reference in your fundamentals textbook for that specific skill if it is in the textbook. Okay? So what we're going to first off do is we're going to look at helping the client who needs to use the restroom. In not all cases, that client is able to get up and go to the toilet like most individuals may. It may be that normally they can, but maybe they have a healthcare provider's order that says they're on bed rest for a certain period of time. So we want to look at the different things that could be offered for that client. First of all, for all our skills, we want to make sure you remember, wash your hands, good hand hygiene. So wash hands with soap and water. You may also have hand sanitizer using that. So I've used my hand sanitizer. Privacy, keep those things in mind, doors closed, curtain pulled. Want to think about working height for my client. So in this case, let's say that the client has called me in and is asking that I help them with going to the restroom. And I looked at their orders and I see that right now they're on total bed rest. So what I would want to offer this client is called a bedpan, okay? So I have my hands clean, I have privacy provided. I am going to put on some gloves. And I'm going to go ahead here and get my bed to working height. You always want to think about your back. So remember, waist level. You definitely too, as far as this goes, how many staff is needed to help with moving the patient in bed? Because this may be a client where actually they have been care planned for a two-person assist. There may even be more than two-person assist with even moving them in the bed. But for this particular client, they can be a one-person assist. So I'm going to just go ahead and take this call bell and I'm going to move it over here where it's just out of the way. So they've called me to their room. I'm going to help them with the bedpan, but let's talk about what is a bedpan and what that looks like. So here, this would just be a regular bedpan. So today you'll notice that this is the larger part of the pan. This is where their buttocks actually sit. The narrow, smaller part will be towards their feet, okay? So this would be a bedpan. It is only for this client that I would use this for, and I do clean it after each use. I'll be disposing the contents in the toilet afterwards. So that's the bedpan we're going to use for right now. So I'm going to let the side rail down for this side that I'm working on. I'm going to help you with the bedpan. So what I want to do here is I am going to move the covers back to allow them for turning, but I'm also keeping privacy in mind. I'm going to ask them, if you will, I want you to grab a hold of that side rail there and turn. Remember, using palms of hands, trying to avoid using your fingertips to grab a hold. Okay. You'll notice this bed already has an under pad for this client. So if there were not one on the bed, you definitely would want to place one when the client is using a bedpan. So here we have this cloth under pad that will protect your linens. The bedpan, you'll notice that when I go to place it, do you see how this wider end is towards their back? The narrow end is towards their feet, okay? So what we're gonna do is ask them to roll back towards me. And this is, you know, obviously the mannequin is plastic. This bedpan is plastic. So sometimes I do have to come and adjust a little bit because you want to make sure that it's under their hips. Okay, now the next thing, in most situations, you want to allow this client to be in a position like they normally would, or as close to, I guess I should say, with using the toilet. So what we can do is we will raise the head of the bed, and that way you have them in a sitting position, because normally we would sit on the toilet when we use it. Okay. Now, I did, just to make sure that you understand, I did put covers back over my client because I want to respect privacy, but I do want to be careful that I didn't have the gown there in the bedpan. I have it like so. Now, I want to allow this client to have time by themselves, so I would lower the actual bed itself to a low position. I would put the call bell in reach. I would wash my hands and instruct the client to notify me of when they were finished with the bedpan. Okay, so I've washed my hands, I've exited. Now they've called me back to the room. So clean my hands, put on some gloves. This would be the time where you may have to get some assistance, because you've got to think about, not only am I removing the bedpan, but I've also have to make sure that if I need to provide perineal care, that I do that at the same time. So you've already watched that in a previous video. However, you know, do you have soap and water? Do you have your washcloths, a towel to dry with? Or it may be that you just have peri wipes at your facility. So you would just make sure that you have those wipes available. You want to have all your supplies before you go to take them off the bedpan. So now that we're going to take them off the bedpan, I raise the bed back up to working height. I'm going to lower the head of the bed, put them back in a flat position. Just going to slightly move the covers back, okay? All right, so now what we're going to do is we do not want them turning until we have got our hands on the bedpan. Because if they were to start turning before I have a secure hold of the bedpan's going to flip and you're going to have a huge mess to clean up. So they are going to turn against the rail there. I can let this one down that I'm working on. If it'll cooperate. There it goes. It was just the user. Okay, so they're going to turn. And while they're turning, I have a hold of the bedpan. Okay? So this allows me time at this point to observe contents in the bedpan. I would never want to take this and just set it on the floor. I'm going to move it out of the way. This is really a great time if you had some help. That would be good. You would provide perineal care. You can also observe their peri area if needed at that point. So they're going to turn back. So I have my bedpan here. Peri care, they've been cleaned. You also, if they may have done peri care themselves. So you could allow them, you want to make sure that you give them something to clean their hands with afterwards. Then we would just want to make sure that we have side rails up. And we could make sure that we let the bed down in low position, because we're going to walk away from the bed. And then I would go at that point, once the bed was down in low position, to their restroom, their bathroom, just there in the room. I would empty these contents, and then I would make sure I cleaned this out, and then I would store this per my facility protocol. So each facility may be different. Sometimes this is stored in the client's restroom. Sometimes it may be in a specific cabinet, or it has to be placed in a certain type of bag. So you would just have to know your facility's protocol as far as that goes. Then, once you have stored it in its appropriate place, so we'll just pretend I've taken it to that, make sure before you leave that client's room that you definitely, I already said before I walked away, I had their bed in lay position. If they want the head of their bed elevated, that's fine. Call bell and reach, side rails up ×2. Now, let's talk about an exception to this. So sometimes my client may not be able to turn, okay? So they could just lift their hips and we could place the bedpan that way. That could be one thing. This is another type of bedpan. This is called a fracture bedpan. So let's just say maybe my client's had hip surgery. I'm using this. So same thing, privacy, hand washing, but I just want you to see how this pan would fit for my client. So if you think of it kind of as a scooper, so I could press against the bed, the mattress here, and it just basically goes under my client like so, okay? So you can see for this one, the wide edge is towards their feet. See the wide end? Where the narrow edge went towards their back. So it just kind of scoops under, okay? So that's called a fracture pan. The same thing for this client. I'm providing peri-care afterwards, assisting with that, looking at my contents. I am making sure I've offered something for hand hygiene and storing this in the appropriate place, okay? The other equipment that I have here is a urinal. Okay, so this is a urinal. Now they do make urinals for male and female, okay? So you will notice on this urinal, and I'm not real sure how good the video pick up, but they're actually calibrated markings. This side has ounces, this side has cc, which is the same as a milliliter, listed on that side. So one of the things that we are responsible for is making sure we measure output. In this case, urinary output for our clients. And so a urinal is a great measuring device. So this could be used for my client who has an indwelling catheter and I go and empty that drainage bag. I could actually empty the drainage bag into here to get an exact measurement. Anytime I measure using a urinal, I would have it on a flat surface and I would get it eye level to measure where the urine was at to get an accurate reading. And so we'll be working more in our math class as far as looking at ounces and milliliters and cc. Okay, so what else do I need to talk about with that? Well, if you're going to handle a urinal, same thing. Just want to make sure that you understand you're going to have gloves on. But this can also be used for a client that is, in this case, this is for a male, okay? So what we would want to do, and I'm not real sure if I have a male client here, so just bear with me real quick. We can, it's the great thing about a skills lab, just a second. So only in nursing skill lab could this occur. So we are going to very quickly go from having a female client to we now have a male client. Okay, we just had to change out some body parts. So let's say this client needed to urinate and they were going to use a urinal. So you'll notice it has a lid here that comes off. So for some male clients, I just simply have to make sure that they have this within reach, okay? And so I would want to make sure I check periodically to see if it needs to be emptied when I go in. I advise you having still that under pad underneath them. Other times you may have to come and hold the urinal and they're holding their penis, okay, for the urine to go in. Sometimes you have to hold the penis and the urinal, okay? It really just depends on that circumstance. Now, where does this go? The urine is emptied into the toilet. It is rinsed out. Where do I place the urinal? I want to make sure if they're using it themselves without any assistance especially, that I always keep it close within reach, okay? So a lot of times what you'll see is they may have it right here, hanging. The thing about the overbed table is what else goes on here? Well, their meal tray. So I'm not going to say it's a perfect world. A lot of times I walked in the room and the client has set it on there. You just want to make sure if that has occurred, you get a disinfectant wipe and you wipe that overbed table before, you know, they're eating or drinking or anything like that from that surface, okay? The other thing that I do want to mention when it comes to a urinal is it is hard plastic, okay? So my client may need some privacy with using the urinal, but this does not need to sit between their legs, I would say for more than 15 minutes, because this hard plastic area could cause skin breakdown. So we just want to make sure they're not keeping it just sitting there between their legs for hours and hours. Honestly, the same thing with a bedpan. That bedpan is hard plastic, and so if you left a client on a bedpan for, I would say, no more than 15 minutes, you need to go in there and check on them, offer the bedpan a little bit later, because that client cannot sit on that bedpan for very long because that could increase the risk of developing a pressure area from that hard plastic, okay? So always keep those things in mind. The urinal too, I had mentioned earlier, this was for a male. If it's for a female, it would have an adaptive piece here on the top. I don't see those as regularly, and I guess high supply areas, but it is an option that you may encounter in your nursing career. Then lastly, I want to talk to you about, so I'm just going to set this to the side, my client assisting them with a brief, okay? So for an adult, we do not call it their diaper. It is their brief, okay? You'll just notice though, it is a large diaper, as if what you've seen maybe with a baby. So when it comes to a client using a brief, make sure you understand, is that brief appropriate for my client? If this client is able to tell you, I need to use the restroom, then number one, can you assist them to the toilet? Could you use a bedside commode? Or do you need to use the bedpan that we offered earlier? Those would be the options for that client. A brief is going to be used for your client who is what we call incontinent. They are not able to control when they use the restroom, whether it's to urinate or to defecate, having a bowel movement. So I would never want to put a brief on someone and say, just go in it because we ain't got time to get you up, or you know, the doctor wants you to stay in the bed, so just go in the brief. Completely not acceptable, okay? So when I go to put a brief on my client, I'm going to make sure I've washed hands, have gloves on, privacy, bed's at a good height, same thing, how many people need to come in to help me. Briefs come in different sizes. So a lot of facilities actually have on that client's chart what size brief they wear, what color, there's like a color coding. That just is, you know, individual facility protocol of how that's handled. I'm going to have the client turn away from me, so they're going to turn to their side. So what I want to do here is when I have my brief, you'll notice the tabs here are going to be towards their back, okay? You don't want to open the tabs yet because you don't want those sticking on the client. And then you can kind of judge as far as making sure it's not too far up their back and you're gonna have enough in the front, but then you wanna make sure you're sharing enough of the brief for each side. So then they'll come back, lay on your back for me. You okay? And I'm gonna pull the gown up here where you can see real good what I'm doing. So then, in this case, I'll let them come just a little bit towards me, and this is a really small client, so I didn't have to pull that much. Now, sometimes you have to really tuck, and you know, you'll have somebody else helping you if it was a larger client. So you'll notice when I go to pull this over the perineal area, I want to make sure that this is not twisted. I take my time, that there is good coverage here in the peri area, but I also don't want it so tight that this is cutting into their growing, okay? So be mindful of that, because they may have put on weight and they may need to have a bigger brief. Then I take my tabs and I make sure that my tabs are being attached to the brief. These tabs can cause a really bad skin tear if they were attached directly to my client's skin. Okay, so then the brief is on. This brief actually has a little line indicator that can change colors if the brief becomes soiled. But I will advise you, sometimes that's not always a good indicator, because sometimes the urine can be at the back of the brief. So, you know, it is best, we will always, our clients are always, we will check and change every 2 hours and PRN unless you have a more specific order for a client that is incontinent. A couple other things that I will mention: you never want to take a brief that is too large for the client and have the concept that, oh, I'll put this large brief because that way they don't have to be changed as often, it'll hold more. No, actually, if a brief is too large, what's going to happen is when they urinate or defecate, it goes out the sides instead of actually catching that. So keep that in mind there. Now, as far as taking a brief off, when I come in, I will always want to take the tabs and turn them back like so. So that way, once I'm removing the brief, there doesn't run the chance of the tabs sticking to the client. Me personally, when I remove this piece right here at the front, a lot of times I'll take the brief and kind of roll it. And then I go ahead and do my perineal care here at the front. And I can even take my wipes, if I were using peri wipes, and I'll put them here at the brief, okay? Or you can have a garbage can right beside you that you're putting that in. Or if you have soap and water and you're using your washcloth, to me, this is a great time to go ahead and clean. Then when the client turns, you've got the brief where you could just roll it. And sometimes if they were larger, you're gonna have to kind of roll it and then tuck it to remove from the other side. So now I have this brief. Obviously, in most cases, we would be putting a clean one on. But then, here's the question of the day. Where do I put a soiled brief? Do I throw it on the floor? Absolutely not. Do I put it in a red bag? In most situations, no, unless there was some type of isolation precaution that was going on for that particular client. This typically goes in the regular trash. So you're probably thinking, why? Because that is actually considered part of the normal waste at a facility. Think about it this way. If you've ever had a child at home, you had a baby, and you changed their diaper, where did you put it? You put it in the trash bag. At the house, the garbage truck came along and picked it up. So the same thing happens at facilities. But as always, I will stress, always know your individual facility protocol, but that is typically how you'll see that's handled. I make sure the bed is in the low position, the call bell is in reach, my hands are washed, and then that will complete that skill. Thank you.